All right. Hi, this is Dr. Nick. I'm the Incrementalist. I'm excited to have Atul Butte. He is here, just come off the stage talking about the integration of data. Atul, thanks for joining me.
Thanks for having me here. It's been great to be here today.
So if you could, just quickly summarize the key points out of your presentation.
Look, I think the country's been spending billions of dollars on the electronic health records. We're barely using this data. It will be a national tragedy if we don't actually use this data in a safe, respectful way, if we don't use this data to improve the practice of medicine.
So the incremental improvement in your mind is free that data and integrate it. Any specific guidance for people that are struggling with this? Because we hear about data blocking, we hear about it's unavailable, it's impossible. How do we go about this?
You got to think through the incentives. You got to think about the business reasons why someone wants to share data or doesn't want to share data, and work through those and work around those, right? If you can come to a business entity and show that it's in their financial incentive to actually open up the data, they'll gladly open up the data. It's always the case. But you got to think about business models too, not just the tech.
So I love that. The incremental point in my mind is follow the money and understand the financial incentives.
Always.
And ultimately, if you can marry up those incentives so that your agenda matches to the agenda of the data holder,
there's no issue there.
Everybody's working in the same direction.
Everyone's in the same direction. That always happens.
So any thoughts about some of the potential for the integration of that data? I know you're knee-deep in some of it.
Yeah, so University of California now has all agreed, our academic health centers, to put all that data in one place. I showed some of the results on stage today. I think we can get to quality measures. We can really start to figure out what drugs are working, what drugs might not be working as well as we thought they would. Those are answers the country needs. And again, we got to do this in a safe, respectful way, right? We got to follow the rules and actually go beyond. But the country needs these answers. It's up to us as academic medical centers to do it now.
So one final question, pushing the boat out here. Do you think the randomized control study is a thing of the past?
No.
No?
It's always going to. The randomized control study is not going away. I think it's we need that for approval for a drug, but after a drug is approved, we really should see if those drugs are working in our patients. So there's a new type of study. Real-world evidence, real-world data is what people call it. It's not going to put it away, but I think we need this kind of study too.
So thinking about the next innovation, is it more of the genomics? Is it the proteome? Where is all this new data?
I'm a genomics guy. I love all of that. We're not even making enough use of just the raw electronic health record data today. Still a long way to go there.
All right. So just remains for thank you very much for taking the time.
Thank you very much.
I'm Dr. Nick. I'm the Incrementalist. Don't let perfection stand in the way of progress.
Absolutely. Voltaire.